older, people get worried about lifting heavy weight. We stop challenging ourselves as much. We become safer in all the activities we do. Movement is medicine, but should we really challenge ourselves in terms of lifting heavier weight? In terms of reducing our risk for all-cause mortality, improving physical functioning, mobility, levels of independence, and overall quality of life? Well, the short answer is yes, according to a recent randomized controlled trial involving 369 older adults ranging in ages from 64 to 75 years, 31% men, 69% women, if you guys were curious. And what they did was they had them exercise 3 days per week for a year. They either did high intensity resistance training, moderate intensity, or no exercise at all. They measured levels of strength and physical functioning, lean body mass, and visceral fat mass. And what they found after a 1 year, 2 year, and 4 year follow-up was even at the 4 year follow-up, so 3 years subsequent to that 1 year of resistance training in just 3 days a week, in the high intensity resistance training group, the heavy weighted resistance training group, we could say, they had improvements in physical functioning, in muscle strength, and lean body mass compared to the group that did moderate intensity training. Of course, they had improvements compared to people who didn't exercise at all, right? But also to those who did moderate intensity training. So let's kind of talk about what they classified moderate intensity or high intensity training as. So high intensity training was anywhere from 6 to 12 repetitions at 70 to 85% of their 1 rep max. So the amount that they could do in 1 rep, the maximum amount of weight, it was anywhere from 70 to 85% of that, 6 to 12 reps in the high resistance training, the heavy resistance training, high intensity training group, you could say. The moderate intensity group did anywhere from 50 to 60% of their 1 rep max for 10 to 18 reps. And the control group, of course, did no exercise at all, right? Now, this shows that doing these junk reps, like we were talking about yesterday at One Wellness, where you just, lifting lightweight over and over and over, even for people that are elderly, not just for young athletes and people that are trying to become in better shape and improve their physical performance and, looking for ergogenic enhancing things in life, or physical performance enhancing things. It's important for the elderly also to challenge themselves and lift heavy weight. And this doesn't just go for bone density, and this doesn't just go for reducing your risk of all-cause mortality. It goes for strength, and even years following the exercise regimen. So who knows what they did for the next 3 years, right? But they were not going through some controlled trial of exercise. And these people may have been generally healthier, right? And maybe they were walking more and they were doing a little bit more. And so at the 4 year follow-up, they were more likely to see beneficial improvement. But nonetheless, lifting for that year made a lasting difference on their muscle strength and functionality. So heavy resistance training can improve quality of life, independence, movement in these people that are in the geriatric population. And so we should cater our training regimens to help them do this, right? Instead of being overly safe and having them do these light-weighted junk reps and just using resistance bands and stuff like that. Test yourself, people, even as you age. So how about that? So what are some possible mechanisms, of action for this? Well, we have neural adaptations here, right? Meaning the nervous system, how it connects to our muscles, adapted over time, even years after that heavy resistance training. And so it's increasing levels of acetylcholine receptors at the neuromuscular junction, where the nerve meets the muscle fiber, right? And acetylcholine is the learning neurotransmitter. It facilitates learning and memory and focus and attention and motivation, arousal, of course, but also muscle contraction, right? Increasing motor unit recruitment, okay? So this is overall facilitating greater neuromuscular function is heavy resistance training. And this is just so amazing because it's something that a lot of people would worry about. And people would say, nobody older should be doing that. I'm not saying if you're older, you should be you lifting boulders and hurting your back or anything, right? But test yourself. That's really the gist of this video here. And this is some really promising research because it was a long-term trial that followed up with these people after some time. Now, in terms of visceral fat mass, both the heavy resistance training and the moderate intensity group saw baseline levels of visceral fat, meaning they did not have increases in visceral fat mass. And that shows that any form of resistance training can help to reduce levels of visceral fat mass. Got a patient coming in, got to close the door here, over time. But the control group had increases in visceral fat mass. And so exercise in itself will help to reduce visceral fat in the long term, right? And visceral fat is that kind of fat that's not subcutaneous fat, meaning you see like fat in your belly, right? It's a type of fat that surrounds your organs. So it sits on top of your liver, or it sits on your heart, right? And that increases your risk for all-cause mortality, increases your risk for diabetes and cardiovascular disease and all these terrible things. So that's what we got for you guys today. I thought it was super, super neat, and you can go and lift heavier if you're in the geriatric population with confidence. This was a very powerful, powerful study, and I was so excited to share it with you guys, even though it's real early in the morning and I gotta go treat a patient because they just walked in. So we'll say hi real quick. Dave Bishamni, Sabia, what's up, baby? I'll sing to you later. Or I'll sing to you now. This way, in case I forget to sing later, at least I sang to you today. As for now. So we got for you, folks. We'll see you tomorrow, baby. Not sure where, not sure when, but we'll see you then. Have an amazing day. Thank you so much. Happy Friday. Happy When Wellness. See ya.